History of methylene blue really quickly. It was discovered in the 40s. It was a synthetic compound made to dye, amazingly, as I'm wearing. Methylene blue has a lot of biomedical uses, not just industrial uses, but I want to go back and cover why is it a thing that we even are talking about methylene blue. And we're going to talk about a complex subject called oxidative stress. There are many different things that cause oxidative stress in life. You can name them. Anything you feel pain, anything you feel stressed about, anything you see floating in the air probably is oxidative stress. And it's exacerbated by the things we eat, by the things we do, by our lovely humid environment, and you can see the list. It's even ionizing radiation, sun, it's tanning beds, it's things, all the things that we're expose ourselves to extra above and beyond, including chronic infections, Lyme, Epstein-Barr, etc. You can read the list. And really, one of the things that's most commonly under-recognized is dental abscesses, oral pathology that you may not even recognize that you have. And we really need some more biologic dentists to take and address these things. Anyway, we can measure and monitor blood pressure, weight, obviously for inflammatory states, symptoms, obviously, and then we can actually physically measure that by looking at autonomic nervous system testing, which is looking at sympathetic and parasympathetic balance or imbalance, and then we have a few ways here in this clinic that we can measure endothelial function. These are visual examples of things that are in our environment that affect us, and then this is a representation of 214,000 genetic markers in our human DNA that are potentially impacted by oxidative stress. The red are things here that are reductants, and the blues down here are oxidants. Not necessarily good and bad, because you need both biologically, but there tends to be a whole lot more bad than good. We'll just leave it at that. Redox potential, that's a term you're probably not as much familiar with, but I'll just read it. Redox potential changes are associated with initiating a progression of diseases including cardiovascular disorders, neurodegenerative diseases, cancer, and we'll just say chronic infection. A summary of redox is oxidation, or ROS stands for reactive oxidative stressors, or reactive oxygen species is really what ROS stands for. And those things are necessary. They happen in normal metabolism. And then there's a healthy oxidative process that happens in us, but there needs to be balanced signaling and then regeneration and healing. What happens is like I said, there's many things in our environment that stresses out, chemicals, all types of oxidants in our life. Anyway, that leads to more inflammation. And remember, we always say that pain equals inflammation. If you're feeling pain, there's inflammation. And then prolonged oxidative stress triggers the immune system, and therefore it leads to chronic disease. All right, let's go small. Inside every cell, the animal cells, you have the cell membrane, have all the various parts, and these little blue guys here are the mitochondrion. So then I take the mitochondria, it's now not blue, but we blow it up, and you can see it's very complex inside the mitochondria. There's the outer membrane, and this yellow line is the inner membrane. So we go even smaller, and this is where cellular energy is made in the form of little packets called ATP. And you can see this is representative of the outer membrane and then the inner membrane. So going way back to cellular physiology, in metabolism or in the production, the end product of ATP, we have 5 different complexes that are embedded in the inner membrane. As you can see, there's a lot of plus signs here and a lot of negative signs here. This is like a battery. This is like an environment outside and inside the inner membrane that's regulated by all these various complexes. And you can just see representative here, NAD, FAD, you have CoQ10 involved here, and then the final process in complex 5 of actually making ATP. That's energy. That's what each of us needs, not just in the morning to wake up, but every day, all day, even while we're sleeping. In the process of making energy, we get these ROSs. This is reactive oxygen species. Too many of those, or an imbalance of those, leads to cytokine storms. We all know that term now, inflammation, and other mediators, and eventually not just neurodegeneration, that's one example, but physical and chronic inflammation like chronic infections that we can't clear well. So when we treat these things, we're doing our best to address each one of these steps along the way for people who have chronic fatigue, chronic inflammation, chronic infection, chronic symptoms, of course, neurodegenerative things, where we supplement niacinamide to help here, because N is niacinamide, riboflavin, vitamin B2 helps with that, that's 2B vitamins, CoQ10 helps complex 3, and then we just haven't had a great support for complex 4 until bring on the stage methylene blue. Methylene blue, as you'll see, is a very happy donator and receiver, storer of electrons. Methylene blue improves the efficiency of every one of those mitochondrial complexes in energy production, so therefore it improves the production of ATP. It helps with reducing that down at the bottom, the reactive oxygen species. It neutralizes those. It reduces inflammation of those. And as an FYI, there's a thing called leukomethylene blue. So if I took this bag and we sucked all the oxygen out of it, this would turn clear. It's just a matter of oxygenation or not oxygenation. Very interesting. And actually the clear form of this is what actually works to do the reduction of the oxidized states in the body. It's a buffer. And the cool thing about methylene blue is it easily goes back and forth between clear and blue, clear and blue. And I don't have a demo, but you can YouTube that real easily and see it. It's kind of interesting. But anyway, but then it also reduces not just inflammation, but unbalanced inflammatory signaling. And that's a key thing in terms of cell-to-cell communication and immune response and cellular healing or regeneration. So therefore, methylene blue itself doesn't itself cure any disease, but by benefit of increasing ATP, decreasing the inflammatory things that happen in cellular metabolism, it improves the inflammatory state. Therefore, the body can recover from any of those chronic diseases. So this is methylene blue in action. It can impact every one of these complexes. Again, and this is just representing the leukomethylene blue, is what makes a big difference in complex 4 inside cellular respiration. To get past all the sciencey part, a good example is like in Lyme's disease. Lyme's disease is a chronic infection from a tick-borne agent called Borrelia, and it's very difficult for many people to clear, as is Epstein-Barr, a virus and a bacteria. Methylene blue itself has antimicrobial properties. What it does is it affects the adhesion or the stickiness of that infectious agent to the cells of our body, and then it also impairs the cell membrane integrity of that bacteria. Then that effect can be affected even greater by using photodynamic therapy. That's the PDT. That's using red light. So each of the agents that we use for photodynamic therapy use different colors. There's green, there's yellow, there's blues affected just generally by ambient light, but if we take and we want to even, which I won't go deeper into today, we can even accentuate that by using red light. And you're seeing that happen more and more in a lot of the wellness spas and that sort of thing. Methylene blue is attracted into the cell, which then, because it needs it to make energy, and then it has a deleterious effect to a lot of the microbes, but not to the healthy cells. It helps bolster them. It can penetrate biofilms as well, which is a protective measure that many infectious agents either secrete or develop, or the body does in a response. And then because it can penetrate through, make little holes in the biofilms, it can then get to the actual infection or inflammatory thing that's causing the disease and then destroy it. So here's some other examples of Bartonella, bacteria, yeast, fungus, parasites, viruses, and you've heard of mad cow disease, prions. All these things are susceptible to methylene blue. And yes, COVID is susceptible as well to methylene blue. So in summary, methylene blue can be taken orally, used topically, very safely. There are some contraindications. The two that I'll cover real quickly is you don't want to be on SSRIs, SNRIs, and then a relative contraindication is Adderall or some of the stimulants. Those meds you don't want to be taken, most especially because of serotonin syndrome with methylene blue co-administration. It can cause serotonin syndrome. There are very few cases, but that's very, very well delineated in the literature. There's one FDA approved indication for methylene blue, so this is a vetted thing. It's used in, anybody know? Methemoglobinemia, which is carbon monoxide poisoning. So this could be used if someone were caught in time and needed recovery. It's used in infectious causes as well, being used in malaria. For resistant cases of malaria, methylene blue can be administered to help someone recover. So very safe, unrecognized treatment modality, which we'll be using here in the clinic more and more.
There have been a lot of questions about methylene blue, especially regarding the anti-aging properties of methylene blue. So in this video, we will look at the science behind this compound and its potential benefits for extending lifespan and promoting overall health. Now, methylene blue, often recognized as a dye or medication, has recently sparked interest in the realm of anti-aging research. But what exactly is methylene blue? Now, at its core, methylene blue is a synthetic compound with a striking blue color. Originally, it was used as a dye and then later as a medication for various medical conditions from the late 1800s on. Now, its therapeutic potential goes far beyond its dying capabilities. Methylene Blue is a fairly potent antibiotic and antiviral agent and was used to treat malaria and urinary tract infections before the development of penicillin and other antibiotics. So it was sort of our first antibiotic that we had. And even today, methylene blue is used in the emergency room for conditions like cyanide or carbon monoxide poisoning. It can be given orally with a fairly high bioavailability. That means that a lot of it actually gets in, or by intravenous injection. Now, as we age, our bodies undergo numerous physiological changes, from cellular damage to DNA mutations and oxidative stress. Now, these factors contribute to the aging process, leading to a decline in physical function, skin aging, muscle wasting, and increased susceptibility to diseases. Poor nutrition and lifestyle choices, of course, have further, let's say, exacerbated and accelerated our health decline through obesity, diabetes, and heart disease. Now, I have discussed in a previous video that at the start of many of these diseases is mitochondrial dysfunction. Once our mitochondrial health declines, our cells can sustain damage from an increase in reactive oxygen species that are generated at the inner mitochondrial membrane. So as the mitochondria are malfunctioning or they have problems, they generate these reactive oxygen species, which are extremely damaging to our cells, right? However, emerging research suggests that methylene blue may offer a promising solution to combat aging at the cellular level, particularly through its interactions with the mitochondria. Now, methylene blue acts as a redox molecule, meaning it can accept and donate electrons within cellular pathways. And this property enables methylene blue to enhance mitochondrial function by supporting the electron transport chain. And that's where our cellular energy in the form of ATP is produced, leading to improved energy production and reduced oxidative stress, as well as a reduction in these reactive oxygen species. So we're having less of these reactive molecules manufactured when we have methylene blue involved here, right? The animal studies have provided compelling evidence supporting the anti-aging effects of methylene blue. Research has shown that supplementation with methylene blue can extend lifespan in various organisms, including worms, flies, and even mice. Furthermore, preliminary human studies suggest that methylene blue may offer benefits for age-related cognitive decline, especially dementia of Alzheimer's type and Parkinson's disease, as well as cardiovascular diseases. In a 2023 review in Kuehne, the authors state that methylene blue is a promising treatment for neurobiological disorders, including Alzheimer's, Parkinson's, and traumatic brain injury. Animal studies and clinical trials have demonstrated its potential to improve cognitive function, reduce oxidative stress, and protect against neurodegeneration. However, of course, more extensive clinical trials are needed to confirm these findings and address, some of the adverse effects, and there are safety concerns as well that need to be discussed, right? In my opinion, though, the safety concerns are mostly dose dependent, as methylene blue is a hormetic drug, where lower or proper amounts, let's say, can be therapeutic, while higher amounts may achieve the opposite effect. So it's very important not to overdose on this, because then it actually can become toxic, right? So despite its potential benefits, it's essential to approach methylene blue supplementation with caution. Like any compound, it carries potential risks and side effects, of course, especially at high doses. The generally accepted safe oral dose for, and this is important, pharmaceutical grade methylene blue. So there is methylene blue that's still used as a coloring dye, and then there is pharmaceutical grade, which does not have some of the contaminants like heavy metals in there, for example. So pharmaceutical grade methylene blue can be taken orally, and the general recommended safe dose is 0.5 to 2 milligrams per kilogram body weight. This is, of course, not medical advice at all. Now, there are real contraindications to taking methylene blue, like, for example, pregnancy, a G6PD enzyme deficiency. So this is something that you're born with. It's an enzyme called glucose 6-phosphate dehydrogenase. And that is an important enzyme that if you can't break down certain compounds like methylene blue or high dose of vitamin C, that can lead to a hemolytic anemia. But a blood test, this is a one-time blood test that you have to do to find out if you're suffering from a deficiency in this enzyme. It's something that usually doesn't change through a lifetime. And then you can rule this out. At the lower doses, it is debatable whether the blood test is needed. Out of caution, I would always recommend it though. Or another contraindication would be the use of SSRIs, so selective serotonin reuptake inhibitors. And it's usually at higher doses because methylene blue itself can act a bit as an antidepressant. It's actually used in psychiatry to treat various psychiatric conditions, including depression. So it can affect serotonin levels. And if you've already taken a medication that increases serotonin levels, there can be something called serotonin syndrome, which is also, of course, an extremely dangerous condition, right? So you should always, of course, consult your doctor prior to taking methylene blue, especially if you're taking other medications, right? And again, in my opinion, the dose that's recommended, these 0.5 to 2, and sometimes it's actually in the literature up to 4 milligrams per kilogram per day is extremely high. And I'll tell you, so for me personally, I weigh about 80 kilograms, let's say. So again, I could take up to 4 milligrams per kilogram. So this, of course, a pretty high dose, like something on the order of 320 milligrams a day, which is something that I think most people really wouldn't. We're talking here more about intravenous use. And I would not recommend these doses. Even 0.5 milligrams per kilogram for an 80 kilogram person like myself would be 40 milligrams per day, which I think still is very high. And again, I would not recommend doses that go even that high. And I don't think it's necessary. Keep in mind, it's a hormetic drug. So, if you go overboard, first of all, you might get an adverse effect as it affects, for example, your gut microbiome. And I'm going to talk about that in a second. But you might also have other issues with it. And you might not get better effects that you're looking for in terms of anti-aging and cognitive effects, right? So I have been using methylene blue, the pharmaceutical grade, orally 3 days per week for the past 2 months. And on those days, I take 10 drops, which is 5 milligrams. Each drop is 0.5 milligrams twice a day. And there are really no low-dose long-term studies with human subjects available to my knowledge. So out of caution, what I will do, I will take, 2-week breaks here and there, just to make sure that I have some time that it clears out completely. Now, one possible long-term issue may be the disruption of the gut microbiome. Since methylene blue is an antimicrobial agent, it is feasible that not only the bad bacteria, right? Bad bacteria are eradicated, because it is an antimicrobial and has been used again to treat bacterial infections, but it may also affect some good bacteria in your gut microbiome, and that could cause problems, of course. Now, there was a 2020 study in rodents, and that was sort of, presented as a long-term study, but it only really was 4 weeks. But they showed that over this 4-week period, the low dose, which was 15 milligrams per kilogram per day, which is a huge dose, the mice that got that dose did not experience changes in their gut microbiome. So this was okay for them. While the high dose, 50 milligrams per kilogram per day, did affect them negatively in terms of their gut microbiome and did not improve their cognitive ability. They saw how well they were functioning in mazes and all that. So they tested how well their brain was functioning. And so the higher dose did not improve cognitive function, but it definitely caused concern about the gut microbiome, right? Again, much higher dose than we would take or I would recommend. So I don't think that it would be a huge impact on our gut microbiome, but this might also vary from person to person, right? So again, always use caution. This is not studied long-term. Talk to your doctor first, right? Now, I have noticed a significant improvement in mental clarity and focus. And again, methylene blue does cross the blood-brain barrier and can improve the function of your neurons. And as I mentioned earlier, it supports the mitochondrial function in your cells. And that is extremely important, especially as we get older, because mitochondrial function and mitochondrial density decreases with age. When you're younger, you have more mitochondria and they work better. That is one of the hallmarks of aging. And methylene blue can, to some extent, reverse that and make it better. So there is an anti-aging property with any tissue. I mean, whether we talk brain or skin or muscle or organs, it does affect a lot of pathways there. So I think this can be very positive because once our mitochondria are functioning better, the cell's health will improve greatly, actually, right? So more energy, less fatigue by the late afternoon. Those are some things that I've experienced. I'm more functional. I get more done. And there is maybe a mild mood elevation as well. Again, it is used in psychiatry sort of as an antidepressant or antipsychotic sometimes as well. So it does have an effect on your mood, which I would call a positive effect there, right? I've also noticed improvement in skin and hair. And that was actually very interesting to me. So, that was not the main reason why I'm taking it, but I did notice improvement both in skin and hair. And that's, I thought, was very noticeable and pretty amazing that even over that short period of time, that was noticeable for me. Now, it's interesting that red light and near infrared light can amplify the efficacy of methylene blue. So on the days that I take it, I spend either 20 minutes in the sun outside, could be indirect. Remember, near-infrared radiation is reflected from, trees and all that. So if there's nature around, you're usually good, right? Or I use the LED near-infrared bed that we have in our clinic, right? So I think the combination is actually worth doing here, right? As a word of warning, when you take methylene blue orally, it will color your tongue blue, extremely blue, for a little while. And your urine will get blue or green. I mean, this is not a big deal. This is something that goes away, but that is something that you notice right away. So that is very profound with this medication, right? It also tastes awful, to be honest with you. Just like you think blue ink would probably taste like, right? So anyway, as the researchers continue to unravel these real mysteries of aging, I think that methylene blue remains an extremely captivating, subject of investigation. Its ability to target multiple pathways implicated in aging makes it a very promising candidate for future anti-aging interventions. So in conclusion, while we're only scratching the surface here of methylene blue's anti-aging potential, I think the evidence thus far is undeniably intriguing. And from enhancing mitochondrial function to combating oxidative stress, this compound, methylene blue, offers a very multifaceted approach to promoting longevity and vitality. So anyway, if you found this helpful, please don't forget to like and share this video. Also, if you are taking methylene blue, if you have experience with methylene blue, I would love to hear about it. Again, I only knew this from the emergency room, so it's always interesting for me. And back then we used it again to treat carbon monoxide or cyanide poisoning, which is very rare. So I never got to see it in action. But if you're taking it, please leave a comment how you're taking it and what you've experienced. And I'd love to hear that because it would actually greatly help other people as well to learn from. There's a lot of confusion about the oral dosing of methylene blue, and that's because in the literature, they often refer to the intravenous dosing, something we would use in the emergency room for someone with cyanide poisoning or carbon monoxide poisoning. And that dose is given as 0.5 to 4 milligram per kilogram body weight, which is a huge dose. And I never even take close to that orally. But a lot of people look at that and they dose it based on that. And I think that might actually be a mistake. And that is because when we take it orally, one thing we have to keep in mind, part of it is actually going all the way through the digestive tract. And keep in mind, methylene blue is an antibiotic, so it would certainly kill off some bacteria. And if it kills off some of the good bacteria in our gut, we can cause a massive disruption in our gut microbiome. Now, this usually doesn't happen until doses that exceed about 30 milligrams per day. Under that, it's very unlikely that methylene blue will disturb the bacteria in the gut. We also have to keep in mind that methylene blue has an excellent oral absorption. It's somewhere in the order of 80 to 90%, which is extremely rare for any medication. So I would argue, taking it orally or taking it intravenously is, very comparable in this case. Again, keep in mind, though, that taking it orally, again, some of it will go all the way through the digestive tract. That's one of the differences here, right? And when you look at the doses that we need to achieve really its nootropic effect, for brain health, for energy, for concentration, functioning, and all that, we may really not need excessive doses. I have, looked at what some people have been taking to just improve their memory, especially elderly patients. So people in their, 60s, 70s, 80s. And some of these doses were extremely low, quite surprisingly. Now, again, this is not a big study. These were individuals that were reporting taking this over several years. And the lowest dose I've seen is somewhere in the order of 2 to 3 milligrams daily, which is a very tiny dose, obviously. And some people would go all the way up to about 20 milligrams a day. Some of the studies that were done that showed that methylene blue had a great effect on preventing or treating dementia of Alzheimer's type, or even dementia of Parkinson's disease, were done around 16 to 17 milligrams. And that dose is something that some manufacturers now are using as a daily dose when it comes to brain health. Other manufacturers go a bit higher. They recommend up to 30 milligrams a day, again, which is, to me, almost on the excessive side. Keep in mind, at some point, we might disrupt the gut microbiome. So we have to be a bit cautious there, right? But I would always say, and of course, none of this is medical advice, because there's some people that should not take methylene blue, especially if you're pregnant or you have you're taking an SSRI. You should be very cautious. Always ask your doctor first. This is a real medication that has real potential side effects. So selecting it, first of all, you have to make sure it is pharmaceutical grade. You have to get a good quality methylene blue. Methylene blue is also a dye, and it's used as that. The dye, so the industrial version of this, is full of heavy metals. It's very, very toxic. So you should really not consume that. So you got to make sure it says USP on it, So USP grade or pharmaceutical grade, that's really extremely important. And then you can start with lower doses. Again, not medical advice, ask your doctor first, but you can start in very low doses and titrate slowly up. So I started really with about, 5 milligrams a day, and I'm currently taking between 6 and 10 milligrams a day. We also have to keep in mind the half-life of methylene blue, which is somewhere between 5 to 7 hours. So some people will take it twice a day. For me, I mostly only take it once a day. Keep in mind, this is an average half-life, and this might vary from person to person. So I would usually take methylene blue in the morning, somewhere around 9 a.m. And if, on occasion, I would take a second dose around, 1 p.m. or so. I don't take it much later than that. Initially, I dosed it twice a day, with the second dose being closer to the evening, and it does disrupt my sleep. Not everybody feels that way. There's some people that report sleeping just fine, because it is not exactly a stimulant, even though it can raise heart rate and it can raise blood pressure. So I do find it quite activating. I did a short video about this, kind of warning about not taking it before a workout. I did that at one time, and I definitely had a very significant increase in heart rate and blood pressure and felt lousy. So I think this is not a great supplement or medication to take before a workout. I would wait at least 2 to 3 hours before training or take it about an hour after. I work out in the morning, so for me, I usually work out first and then take it afterwards. But that's something that's actually important also to keep in mind. If you have high blood pressure, again, that's why you should talk to your physician about it. You may keep that in mind. You may have to adjust your blood pressure medications. You may have some real issues here with taking methylene blue. It is sometimes used, even in the OR, to stabilize blood pressure during an operation. So we have indicators that this is something that we can do to influence our blood pressure, so it can raise blood pressure, in other words. So then again, half-life of 5 to 7 hours, dosing depending on that. I think taking a once-a-day dose is probably sufficient. But again, you can also take, if your dose, let's say, is somewhere around 10 milligrams, you can take 5 milligrams at 8 a.m., another 5 milligrams at noon, and that'll really extend it until the late afternoon in terms of its efficacy. It will stain everything it touches. So even if you take it in a tablet form and you keep the tablet on your tongue for too long, it'll stain your tongue very, very blue. The liquid is a very, very powerful stain. So in my experience, if you have it on your countertop or on your floor, I mean, once it's there, really hard to remove it if you're able to do that at all. That's something to keep in mind. And you can tell, of course, when you excrete it, most of it will be excreted unchanged in the urine. There's minimal metabolism in the liver. Most of it will come out as, as it came in, as regular methylene blue or as leukomethylene blue, especially in the presence of vitamin C. So the leukomethylene blue is clear. And some preparations use vitamin C with the methylene blue. And if it's a liquid, the liquid is usually actually clear. But again, it's usually excreted, and you can tell in your urine. Urine will be greenish blue. It's a sign that you're excreting it. Some people have suggested you can use that sort of as what's your particular half-life. I mean, as long as you that observe every time you use the restroom, if you still have a greenish blue urine, there's probably still significant amounts of methylene blue that you are currently using. And this kind of helps you understand your half-life a little bit. I think that's a very crude way to measure it. But again, it's a simple thing to do. And we don't really have, you can't just do a blood test easily to test how much methylene blue is in your system. That would be very complicated to do. So yeah, so I would always be very cautious in terms of the dosing. I don't think we need a lot of it. It's a hormetic drug. That means in small amounts, it has a certain effect. In high amounts, it might achieve the opposite effect. This is something we can certainly observe in methemoglobinemia. That is essentially where the iron in the heme is changed from its ferrous state to a ferric state, to an oxidized state. And that doesn't allow the proper transport of oxygen. It's a very dangerous condition. Now, methylene blue in the right dose can reverse that. So then it actually, helps to take care of this problem. But in very high amounts, it might actually cause it. So that's what a hormetic drug is. In low amounts, or in appropriate amounts, I should say, it has a certain effect. But when you go above that, then you can have the opposite effect. And that's something to keep in mind. So at low doses, it treats it. At high doses, it might cause it. And this is very important because another contraindication to using methylene blue is a G6PD deficiency, which is a glucose 6-phosphate dehydrogenase deficiency. It's something that is a genetic abnormality that you either have or you don't. It's nothing that usually changes throughout your lifetime. People of Mediterranean background are more prone to have this. You can do a lab test for a G6PD, so again, glucose 6-phosphate dehydrogenase enzyme level, and it'll tell you if you are in that range. If you're in range, then you usually will not have problems taking higher amounts of methylene blue. Again, I don't think you actually ever need to. This is more for intravenous use again, but you can rest assured that it will not have this negative effect causing this methemoglobinemia. Now, at the doses, though, that we're talking about here, somewhere between 5 and 15 milligrams at the very high and 30 milligrams. Again, this is not official medical advice, but I would really be extremely surprised if even someone with a G6PD deficiency would encounter methemoglobinemia. However, it's always good to be cautious. And if you are affected by this, then you should talk to your physician. You should always talk to your physician before using it anyway. But in drops, so 0.5 milligrams per drop. There's a tablet form as well. But you really got to read the label. Again, and these very high doses, we're talking 0.5 to 4 milligrams per kilogram body weight. This is mostly for conditions treated, in the hospital where we give it intravenously, and I would really shy away from those. I don't think it's necessary for that. Again, even for using it preventively for neurocognitive disorders, we're talking Alzheimer's and Parkinson's disease, mostly, again, 15 to 17 milligrams daily. This is not a huge dose. I think that's actually very reasonable, and this will work very well, apparently, for many people. So I think it's an amazing drug. I've been using it now for quite a few months. I do take breaks on and off. Again, with a half-life of 5 to 7 hours, and at the dosing I'm using, it doesn't really accumulate in the body. However, I think it's good with anything to take breaks. And there's an interesting question that came up about this. Am I going to feel the effect when I'm not taking it? Is there withdrawal, right? And usually there's not. That's interesting. So usually you do not develop tolerance. That means you don't have to continue to increase your dose, but also you don't develop withdrawal. So if you stop it, you just stop it. You should not have real negative consequences from that. This can vary, of course, from person to person, but in general, I wouldn't worry so much.